Hello, welcome to our frequently asked questions. Today I'm answering a commonly asked question about blepharoplasty. Do I need to have general anesthetic in order to have lower blepharoplasty? And my approach to answering this question will be to talk to you about what are the different types of anesthetic that are available, what are the potential advantages and disadvantages of the different type of anesthetic, and then finally, what is going to be the most suitable type of anesthetic for you. My name is Dr. Julian De Silva, and I'm a London-based facial cosmetic and plastic surgeon, and blepharoplasty is one of the commonest procedures that I complete for patients every day, and I have used all the different types of anesthetic that I'm talking to you today about, and these are common discussions that I have with my patients on a regular basis. So firstly, what are the different types of anesthetic? Well, broadly speaking, there are three different types of anesthetic. There are local anesthetic, and what local anesthetic means is using a numbing agent, a numbing local anesthetic into the localized area of the lower eyelid in order to numb the lower eyelid. And this means that you are fully conscious or fully awake during the surgery, and there is just numbing agent that is in that local area. And the equivalent in, say, dentistry would be having local anesthetic just around the tooth that you are having a procedure to. The second form of anesthetic is general anesthetic. And general anesthetic means you are fully unconscious or fully asleep during the surgery. And this means that there are complex machines that are looking after your breathing, and there is an anaesthetist who's supervising both the machines and your care. And this does mean that there is a tube down your throat and airway in order to protect the airway. And we will talk about some of their advantages and disadvantages of general anesthetic in a moment. Thirdly, there is a newer form of anesthetic called sedation anesthesia, and sometimes this is called twilight anesthesia. And this type of anesthetic means literally you are sleeping during the surgery. You're still breathing yourself, and all your natural protective reflexes are working normally, but you are literally sleeping during the surgery, which does mean that your recovery tends to be faster. So, what are the different advantages and disadvantages of these types of anesthetic? So local anesthetic, as we talked about, means that there is numbing agent just in that localized area in which you're having the lower eyelid surgery. Now the lower eyelid tends to be quite a delicate area of the face, and the lower eyelid, although it does numb with local anesthetic, tends to be more delicate, and generally speaking, having lower blepharoplasty under local anesthetic can be a little challenging for a patient because of the sensitivity of the lower eyelid. And often as part of lower blepharoplasty, it's necessary to reshape or remove or reposition some of the lower eyelid fat, also called orbital fat, and this tends to be very sensitive even when it is numbed with local anesthetic. So moving on to general anesthetic, well, by definition, general anesthetic means you are fully asleep, you are fully unconscious during the surgery. So there is a tube that is down your throat, down your airway, that protects your airway, and there are more sophisticated machines that look after your breathing during the general anesthetic. Now, general anesthetic generally has a recovery of 4 to 6 hours before you can go home. And so one of the drawbacks of this anesthetic is that it does sometimes mean you have to stay overnight in hospital, because if you have 4 to 6 hours to recover, it may mean that that is necessary. In addition, because of the side effect of general anesthetic, often you can feel slightly tired or washed out after general anesthetic, and approximately a third of patients will have some nausea or feelings of sickness after the general anesthetic as a side effect of the medicine. Having said that, general anesthetic is very safe. It's been used for many years, and although it does tend to have a longer recovery and have some side effects such as feeling nausea or sickness, it's a very safe form of anesthetic. The third type of anesthetic, well, this is a type of anesthetic called sedation or twilight anesthesia, and it literally means you are sleeping during your surgery. And the benefits of sedation anesthesia are that because you're asleep, you're still breathing yourself just like you would when you sleep at night. All your natural protective reflexes, all the forms that regulate your body are working naturally. So it tends to be a very safe form of anesthetic, and it tends to have a very fast recovery. And although not so commonly used in the UK, worldwide sedation is very commonly used for lower blepharoplasty. What it does mean is that your recovery tends to be about 30 minutes, and for most patients that can be less, and it does mean that you will definitely go home on the day of the surgery. Things like nausea or feeling sick are relatively very uncommon with sedation anesthesia and generally happen less than 1% of the time. So, in summary, we've talked about the different types of anesthetic and what their potential advantages and disadvantages are. What is the ideal form of anesthetic for you to have lower blepharoplasty? Well, there are a few other considerations because ultimately the type of anesthetic needs to be tailored towards you, the individual. And so depending on if you feel particularly anxious about surgery, whether you've had any previous surgery that might result in scarring, in which case the anesthetic may be a little bit less effective in the lower eyelid, well, these are considerations that are very specific to each patient. Generally speaking, my preference for lower blepharoplasty is to give patients sedation anesthesia. This is having used all three different types of anesthetic. From my experience, patients have the most comfortable experience, they're the most relaxed during surgery, and they have the fastest recovery, plus they are ensured that they will go home on the day of the surgery. In terms of sedation anesthesia, well, you generally have half an hour in terms of recovery before you can go home. Generally, the side effects are relatively rare, such as nausea or sickness, and so it has many of the advantages of a relaxing experience but a fast recovery. In summary, we've talked about the different types of anesthetic. We've talked about the different advantages and disadvantages of those different types of anesthetic. And we've also talked about what may be the best form of anesthetic for you to have lower blepharoplasty. I hope this information has been useful for you. Thank you for watching. If you would like further information about having blepharoplasty or eyelid surgery, please have a look at Dr. De Silva's book. This is a comprehensive patient guide with over 250 pages, including color illustrations and photographs, including all commonly asked questions and fears that patients have. This is available through either Dr. Julian De Silva's website or by searching on Amazon.